Okay, should we make a start? I think people might still be coming. Can't see myself, which is slightly disconcerting, but that's okay. I don't see anybody other than Liv. Should I be able to? Who knows? There we are. Right. Okay, here we are. So welcome to this breakout session. We're going to be discussing aging without children and dementia. I'm Jenny Brooks. I'm Associate Professor of Social Policy at Sheffield Hallam University. I've been leading some research about people with dementia who live on their own and who have no informal support with navigating services for the last 18 months. We're going to talk about some of that work today and some of the wider implications, and I hope some of you will share experiences and thoughts as well in the chat. I've got a couple of other presenters and people who've been involved in the research with us today. First of all, Damian, would you just briefly introduce yourself, please?
Hi, I'm Damian Murphy. I'm a Director of Innovations in Dementia, and I've been helping with this sort of the involvement of the project advisory group made up of people living with dementia.
Thank you. Mandy, do you want to introduce yourself?
Hi, I'm Mandy Willcox, and I'm the researcher on the project working with Jenni at Sheffield Hallam University.
Thank you. I can see we've got Fiona Aspinall as well, who's been involved in the project. I don't think she'll be allowed to unmute, but she is a panellist in the next session. And I should also, we've had Penny Shepherd from AWOC East Kent working with us on planning this session. So thank you to Penny as well. So we've got countdown timer in the corner of my screen there, 35 minutes, 36 seconds before we get booted back into the main room. So this is an outline of the session, just briefly what we're going to do. We're going to talk about very briefly about definitions and assumptions. We'll talk about an audit of services that we did. I'll hand over to Damian to talk about how we've involved people with dementia themselves in this work and the benefits that we've found of doing that, and then some findings. And now we are still interviewing for this project at the moment, so these aren't our kind of complete findings, but some really, really interesting things that are coming out I think will be of interest to a lot of people who are here, especially considering some of the discussions earlier this morning. Now, I understand that this is a large group. We've got 61 at the moment in this meeting, and I am told that we can't unmute anybody else, so you're not going to be able to actually physically ask your questions. So put things in the chat. I'm aware the chat was moving pretty fast this morning, so I'll apologise in advance if we don't catch everybody and everything. Please do feel free to drop me an email. We'll check all the messages when the recording comes out as well, and we'll try to get to everything. Okay, can I have the next slide, please? Oh, it's odd not being in control of your own slides. So we heard this morning, obviously, that about the increasing number of people who are aging without children. You're probably also aware there's an increasing number of people with dementia. Dementia was the leading cause of death. Oops. Mm. Sorry, when I planned these slides, I wasn't thinking that I wouldn't have control myself. Yes, dementia was the leading cause of death in England and Wales last year. There's currently over 900,000 people with dementia in the UK, and that's predicted to rise to 1.6 million by 2040. Next slide, please. What we don't know is how many of those people with dementia who are also aging without children. Okay, so we know that a third of people with dementia who aren't in the care homes, who live in the community, live on their own, but many of those will have support from children, other close family members. What we want to talk about today is those people who don't. And a quick word about definitions. So aging without children have their own definition. As we saw this morning, ours broadly follows that. So this is a lot of what I'm talking about today is about a very specific research project, and our definition for the people that we were including and looking at the needs of was people with dementia who live alone and who are managing without informal support to contact and navigate services. So they might have somebody helping them to do the shopping or put the bins out, but they don't have anyone to help that process of kind of getting support from social care or navigating hospital appointments. And as many of us will know from personal experience, that can be a very, very tricky thing to navigate. There's also an issue about other people's definitions, and when we were in the intersectionality session, just briefly, and Kirsty mentioned as well this morning about organisations and services making an assumption that a family member will be involved. Particularly can be an issue for people in the LGBTQ plus community who maybe have families of choice that maybe services won't talk to if they're not specifically named. Also an issue for people whose first language isn't English, where, you know, a difficult to navigate service may become impossible. And why is this an issue? So can we move on to the next slide? Thank you. There's a huge reliance on unpaid carers. We all know it. Usually family members, often children, to provide support for people with dementia in particular. Many of you will have provided support for parents or will know people who have. And if you have, you will know just how difficult it can be getting diagnosed in the first place, finding information, getting support. So next slide, please. People with dementia who live on their own, even if they have a carer, are more likely to have unmet needs, be admitted to hospital and only come into contact with formal services in a crisis. And so what we were looking at is what happens when people don't have a carer. Okay, does that mean people with dementia should live on their own? Absolutely not. Should not live on their own, sorry, absolutely not. Clearly not. There's many benefits to living on their own. People get along very well for a long time. Lots of people do it successfully for many years. So I just want to throw that in at the beginning. This is absolutely not about saying people shouldn't live on their own. What it does mean, though, is that if people don't have that sort of informal carer around them, that person who can help them with navigating those services, they're having to do that navigation by themselves, which can be very difficult. Okay, so next slide, please. And I just wanted to draw attention to this work that's been done by Damian there, and by the group that he supports, the Dementia Inquirers in York, York Minds and Voices, who did a piece of research led by people with dementia that looked particularly about the pros and cons and particular needs of those living alone with dementia versus those with a care partner. And they very much identified there were lots of benefits for people living alone, but also other things that they needed to take into account. So you can find that report freely available online, and lots of others that have been led by people with dementia as part of the Dementia Inquirers project. Very interesting. Okay, next slide, please. And I've already talked about it, so if we can skip over that one as well. Thank you. Right, so next one. The first thing that we did as part of our research was we looked at what services were available specifically for this group of people. So this isn't a comprehensive look at the whole of the UK. Our funding only covers England to start with, and also we looked at local authorities within 2 regions. So Yorkshire in the Humber near the top there in the blue, and North Thames, one of the smaller ones down under the East of England one. We spoke to commissioners within those local authorities in those regions about the dementia services that they commission. So a caveat, this data, obviously commissioners are extremely busy. They don't always want to spend their time talking to researchers as much as we try. And so this data only includes 13 local authorities. And we were actually able to get hold of far more people in one region than the other. Okay, so just as a caveat. Next slide, please. So of those who responded, 10 had actually estimated the number of people with dementia in their area, but none had done any analysis about the number of people who lived alone or had no informal carer. So this comes back to something that we were saying earlier on in the first session about this complete lack of data about this group. We just don't know how many people are in that group. Okay. Next slide, please. I've got notes on one page and my slides on the other page. So every local authority commissions services to support people with dementia, as you would imagine, but only 4 of them had specific arrangements in place to support people with dementia who lived alone. Okay, and these varied. One area had a very specific service, and other areas had kind of pathways, might have involved ongoing phone calls and reviews, might have involved assisting with travel to community-based services, facilitating access to other services, and ongoing telephone calls and reviews. And I just spotted a question pop up there that I will answer about why we picked those 2 areas. Well, there's a couple of reasons. One of them was funding related, because of the way that we were funded and people involved, we had to include North Thames. Partly this was practical, but actually it gives us there's a real mix of very urban, very rural local authorities in those areas, a real mix of different levels in terms of demographics, in terms of ageing populations, in terms of minority ethnic groups across those different regions. So it gives us a real access to what's been done in very, very different areas. Okay, so thank you. Right. So some of the services. Next slide, please. Thank you. Some of the services that were described as day services or leisure services or social services were quite generic services that could be accessed by people with dementia, and some of them were very specifically for people with dementia. None of this type of services was specifically for people who lived on their own. But problematically, some of these, especially those aimed at people with dementia, explicitly excluded people who couldn't attend without a carer or without somebody going with them. So there's gaps here. As far as we can tell, certainly in the regions that we looked at, nobody is looking at population level data about people with dementia who live alone and who don't have an informal carer. So we just don't know how many people are in that situation. I mean, obviously it'd be changing, but like, you know, that feels like people should be knowing that, but nobody is counting. All of the local authorities provide general services for people with dementia, as you would expect, but most of the ones we talked to didn't have a specific service or a pathway for people living alone without carers. And some of the general services actively excluded people who didn't have a carer to attend with them. And I think that's quite worrying, because again, it comes back to that kind of being, you know, that assumption. So one of the other things we've done in this research is we've talked to people with dementia themselves, and people who are currently living alone and who don't have informal support, to see how they manage, what challenges they're facing, what we can learn from them. We've also got groups, we've got several people in that situation on our advisory group at the moment. I'm going to hand over to Damian now to just say some things about, well, I won't even introduce you, Damian. Fire away.
Hi, I'm Damian. I suppose I've got no slides, so you can take the slides off if that helps. Yeah, I'm going to talk really about the experience of just belonging and being involved in the project advisory group, emerging from our members with dementia, who unfortunately couldn't make it today. We'd invited a couple of people, so it just didn't work with their calendars. But right from the start of the program, Jenni and the team knew they wanted to include people with dementia on the project advisory group and as part of the research. I think it's, you know, that's a given now. If you're doing research about dementia and you don't include people with dementia, you're wasting your time, really. We also not just involve people with dementia, we wanted to involve people with dementia who actually fitted the criteria of the project. So, in other words, people who matched those criteria, people living on their own without informal support. And we found them, which, you know, that's always good because people talk about hard to reach, but we found them. And there were people, we sort of had to narrow it down because there were people who were living on their own, but did have those maybe relatives just down the road helping a bit more formally with accessing and navigating stuff. Yeah, as Jenni said, it was that we had a really good conversation about how to title this research, wasn't it? And it was, if you're the person who's the named person on, you know, for you know, navigating your GP or making the appointments with social services or whoever, then, you know, no one else is acting for you, then you fit the criteria, essentially. Yeah, so we found people, and it was really a message out to the DEEP network, which is for those you don't know, is a network of groups, peer groups of people with dementia. There's about 80 odd groups around the UK that We're Innovations hosts. So a bit of a plug for the DEEP network. All independent groups of people with dementia. And yeah, All Life is there. So that's a fantastic resource. So our message is that, you know, there are people out there and that people have got something to say and certainly a wealth of experience to share. And that was no exception. You know, our group was no exception to that, really. So what did we do? We met with our panel, our 4 new members in Sheffield. Wayne, Monica, Farzana, and Michael, and we had a great time. It was a face-to-face gathering of all members of the project, and people had different levels of support, you know, to participate in that. But we met them, and I think that was really important. So not only, you know, did it, you know, the participation, the support in the participation revealed not only, you know, what people can offer and help and the steps needed, but also some of the practical measures that we could take to facilitate the participation, but people particularly who are living on their own. So that gave us some indicators as well. I want to talk specifically about Monica because she lives locally with me here in York, and I think she lives very much in the present, and she's part of the group, and you know, and that's one of her many gifts. And she always described herself as an inveterate picker-upper of leaflets, and that's why she had created over the years a real network of things. And I think it was mentioned in Kirsty's talk earlier on. People are a lot more connected to the local communities. They're a lot more engaged because she's created this sort of support network, and that idea, I think, you know, of, well, if you're on your own, you must be vulnerable and you can't live on your own is as Jenny said, is a real myth. So she's engaged, lived locally. So Monica and I travelled to Sheffield together by train, and we sat together at the meeting. And I made simple notes for Monica because lots of people in the room chatting and people on a screen zooming in from London chatting was an awful lot to take on board because Monica's hearing is also not the best as well. So I was sat next scribbling notes, as trying to be as legible as possible and as simple as possible, saying things like, Jenny's just reminding us that the project is about people who live alone. Okay. Apparently, hardly any local authorities count how many people with dementia are living alone. Ooh. And so that pairing up and that accompaniment every step of the way ensured Monica could give her apposite in the moment comments and feedback. And so we captured everything that she had to offer. It was brilliant because I think, you know, all those assumptions, well, there's a lady living on your own, she can't remember from 1 minute to the next, what can she offer? I think she offered a huge amount. And each of the members of the project advisory group gave their own perspective, and I've seen them grow in enthusiasm throughout the project and get more relaxed. But it wasn't just sharing their perspective as people on their own. What Jenny and Mandy have done brilliantly is create, and we had a couple of workshops and another face-to-face one in Sheffield, where we carried out and participated in the thematic analysis of all the data from interviews of people who live on their own that they'd captured so far. And it was a really brilliant sort of method, and so not just our sharing, you know, the analysis there, and they'd commented on the meaning behind the quotes that people had said, and they could connect, oh yes, that's me, definitely, and oh really, oh that's interesting. And it just, and you know, so it suited Monica down to the ground, seeing that with all the pertinent comments. She was able to sort of come out with their remarks, you know, to really get into the nitty-gritty of research. I thought that was fantastic. And in terms of a practical measure in involving people with dementia in research, you know, everybody knows how universities are dreadfully slow in getting their finance department moving and shifting. That, you know, the agreement we've got is that we reimburse and cover people's time for their participation ASAP, and then, you know, we let the university sort of grind its system eventually to reimburse us. So that's really important. You're involving people with dementia, you recognise their contribution practically, logistically as well. So yeah, so that was really important to thank them for their time and expertise and quickly and efficiently as possible. Just, I suppose, in summary then, involving people with dementia in research is a must. I think we all know that. Involving people living alone in research on people who live alone is a must. And, you know, just to reiterate again, you know, that message, people living alone with dementia are not a burden. They're not a safeguarding issue, but very much a resource. And that's certainly what I found. And it's been great just accompanying this little group over the last sort of 18 months or so. There we go. That'll do for me. I'll let you move on to your next slide, if that's all right.
Thank you, Damian. And it's always interesting to hear your experiences. And what I should say is that obviously Damian was involved obviously right at the beginning, and we got the advisors involved right at the beginning as well. And obviously written Damian in as, you know, into the project, so their organisation is funded to do that work appropriately. And it's enough time, I think. I think you've had a day a week on the whole project, Damian. So. Which has been fantastic, utterly fantastic. So, as Damian said, we recruited people so there's two separate things, but people in the advisory group, who Damian's just been talking about, and we also recruited people to interview, and I'm going to talk about what they said in a moment. And to do that, we did go through the deep network, but we also went through various other places as well, and we've gone through NHS memory clinics, other voluntary organisations. You've got real sort of mix of people. We are still recruiting for a very short amount of extra time now, so if anybody does know anyone in that situation, point them towards us, but please don't send us their names and addresses, obviously. Okay, can we have the next slide, please? One of the other things, while you're sorting out that next slide, is the reason this project came about in the first place was because when the most recent NICE guidance on dementia was developed in 2018, the bit on care planning in particular, it was noticed that all of the research that backed up that bit on care planning, the vast majority of it had explicitly excluded people without a carer. People with dementia without a carer had been explicitly excluded from taking part in the research about care planning. So there was lots of evidence about what worked for people with care planning, but no evidence about what worked for people with care planning when they didn't have a carer. And there's just this kind of blanket assumption behind everything. Anyway, so Liv, can we have the next slide, please? Well, we can carry on anyway. So we've not, as I say, we're not quite finished interviewing yet. So these aren't our final findings. But we wanted to raise some things that are coming out as significant for this group, and to kind of get everybody to sort of reflect on what that means for themselves or whatever. I should point out this is quite a specific set of people who live alone without carers. So we didn't interview anyone who couldn't consent to take part in the project themselves. We didn't interview anybody who's in a crisis at the moment, so our sample is limited in that way. We've talked to 22 people in that particular group, but all of them had dementia, all of them were living on their own, none of them had informal support to help them navigate services or act as that kind of point of contact. Okay, so I think there's some really important things to learn from this group. So the first of them is that many of the people we spoke to are managing really well, and as I said, partly that's a function of the group that we spoke to, but they're managing in different ways, and sometimes they're managing some things really well and some things not so well. So I think there's some really useful things that we can learn about how well people are managing. So next slide, please. So people have worked out really innovative strategies to cope on their own in their homes. So if you can just put that quote on with I was going to say cornflakes, but I think it might be pasta. Pasta cornflakes. So this is a quote from one woman who said, basically, I realise I'm quite dangerous cooking, so I try and work around being dangerous and not having to have people doing it for me. And I work around it by getting as organised as I can and get meals going in the microwave. So this is a woman who's realised for various reasons she can't bend down and lift. She often forgets the timer on the oven, this sort of thing. So she'd arranged for a kind of meal delivery service, not Meals on Wheels, just a local organisation that provided frozen, home cooked, like personally cooked meals. People's strategies changed as their needs changed, sometimes depending on how they felt during the day. Perhaps more obvious things like having a place for everything, always using that place, and that was something that was people felt was considerably helped by them living on their own, because there wasn't somebody else in the house moving stuff when they put it down. So ordinary things like keeping keys, wallet by the door, having a landing place, using timers on the phone or Alexa to remind people of things. People made good use of kitchen appliances, and I learned lots of things that I didn't know anything about during this project, but including things like timers to automatically switch kitchen appliances off, devices just to boil 1 cup worth of water. Lots of people made use of cleaners, actually, occasionally laundry, all these different things, very much an attitude of I'll find a way to do it myself if I can. If I can't, I'll get support in, but it doesn't mean that just because I need support with one thing, I need support with everything. So next slide, please. Lovely, and you may as well go on to the next one as well. We'll go with that quote. This is a really important thing for people was it's all about protecting my independence now, trying to give it as much longevity as possible. The more I can put things in place that's in my life that I'm going to be continuing as opposed to somebody else's impression of my life. So planning for the future was really important to a lot of people that we spoke to, and I've heard that reflected this morning as well in the talk at the beginning. People went into different levels of detail, but many took the approach that this was thinking about something specific now so that they can make choices and decisions and have their needs met in the future. Now, not everybody wanted to think about the future, understandably, but most people had sorted out things like power of attorney, even if they hadn't done any more than that. And that's prompted me to go off and do that for me myself, which I hadn't done. So in many cases, there wasn't an obvious person to take that role. And so people were actually quite creative about who they asked as well. So one person that we spoke to had met someone who was a police officer, and they kind of started helping with their shopping or something. But because they were in that job role, they felt that they were somebody who could be trusted to take on that sort of financial power of attorney type thing. Another was used friend's husband, who was a solicitor. Several people did talk about wanting to stay in their own home, but others acknowledged that there might come a time when that wouldn't necessarily be possible, and they were making plans for it rather than just waiting for it. In one case, somebody actively attending events at different local care homes, effectively kind of shopping around, seeing what sort of thing they might want in the future. Okay, we have the next slide, please. And what I'll do while I'm talking, if you do have, we will go to questions and answers at some point, but if you start putting things in the chat now, that might save us a bit of time, so I think we get whisked back automatically. This is a big theme running through the experiences of all of our participants. Most people had a supportive network of some kind, and many people attended a range of different groups, some related to their particular circumstances. It might be a young onset dementia group or an LGBTQ+ group. Others were more general. Some were dementia specific, some were community groups, faith groups, general interest, things that they've been involved with since before diagnosis. Some of that groups involved advocacy work. Several people particularly mentioned in relation to living alone. Can we move on to that next quote for me, please? If I wasn't involved in activism, it would be tempting for all my thoughts and feelings to turn inwards. It gives people structure to their week. I'm actually not going to use that next slide because it's too many words on it for now. So it's too small, really. So people who were more recently diagnosed very much didn't want to attend groups with other people with dementia. But for most people who'd had their diagnosis for longer, they really stressed the importance of knowing other people with dementia who understood their situation and what they were going through. People talked about the way that they were building their networks, and I think this is somewhere that we can really, really learn here. Sometimes it's about proximity, neighbours. Sometimes they've kind of deliberately gone out to seek people that can help them. A lot of people were deliberately going and get involved in lots of other different groups as well. Several people mentioned the importance of online groups for meeting new people, specifically those, not in an area. Obviously, that's not available to everybody. But in some cases, those had started during COVID, and then afterwards, they'd gone back to face-to-face and left some people quite isolated, actually, where they'd previously been going to something online, and then it just stopped and went back to face-to-face, and they weren't able to do that. Some people, and this echoes what Damian said about seeing people as a did you say resource, Damian? So several people actually ran groups, and whether that was just a quiz in their housing complex or a gentle exercise class that they've been running for years that they just carried on doing, or whether it was just peer support for other people, those sorts of things. So lots of people are managing well, but that isn't always the case, and sometimes networks are either not available or less supportive. We do know that post-diagnostic support is dire in a lot of cases, and I know that Damian and Innovations, as well as others, are working to change that, which is good. This is problematic for everybody with dementia, actually, but particularly those, there's some areas we've already talked about, rural areas, where there just aren't a variety of things available, or people just don't necessarily have transport to get to places, or even if they do, public transport, it's earlier in the morning or it's later at night and it can't be necessarily there. Another thing that's really important and relates to something we said that was said earlier, not by me, was that this idea that groups could perhaps not be welcoming, so more general groups for people without dementia could perhaps not be welcoming for people who had dementia, even if they'd been going to that group before. There was an assumption that they then wouldn't be able to, or that they wouldn't be able to go if they didn't have a carer. So again, there's these kind of assumptions that really can only be dealt with by wider awareness, both of dementia and of people who are aging without children, making people generally, that was mentioned in the intersectionality session this morning as well. So something that's really strongly coming out of here is about how important people's networks are, but also how precarious they can be in certain circumstances. So a lot of people got support from peer groups, or groups, groups that were kind of dementia cafes, or other types of groups that run for people with dementia. They're really dependent on funding, and several people had groups closed down because they'd lost a local authority contract or something, and they had therefore lost contact with people in those groups. Now, some people were actually, the people that they met at the group, they very quickly started communicating with those people outside of that group. And I wonder whether that's something that actually is a really simple thing that we can learn to encourage people who are going to a group to quickly get in contact with other people, and then their network isn't dependent on that group continuing to run. Another thing is around, even when people had a really strong network, often people in that network weren't in touch with each other. So if something happened, maybe one person would know about it, but all the other people wouldn't necessarily know about it. And so I think that, again, that's another learning point that's really a really easy one to do something about to some extent. So in summary then, there's actually little knowledge about how many people are in this group. There's very few specific services. There's an assumption that there will be a carer very often. Next slide, please. People have got really good strategies. We can learn from them. Many people want to plan for the future and are doing. Networks are really important. They can be precarious, but there are things that we can do to make them less precarious. And so there's two last slides really while we go to the questions. One of them was a question about what you can do. Another one, I just wanted to briefly say what we're doing next. We have got a webinar for social care providers, which will basically is in another month. So we'll have full findings by that point. It'll be a couple of hours long, and we'll be talking about specific sort of next actions and stuff. And then we're actually also holding workshops, face-to-face workshops, to co-design resources in November. So resources for people with dementia, for social care providers, and for commissioners. So we will circulate links to book onto those with the information that comes after this. So if you want to put that next slide up, and then we'll look at the questions as well. I can see Fiona's been answering some of them as we are going along, aren't we? So just bear with me while I just... Peter's just offered to put me in touch with somebody. Yes, please, that would be great. Yeah, Damian's put... Oh, it's hard this, isn't it? Pinging through the questions at the same time. So Monica said, yes, power of attorney is difficult if you have no relatives or family. Solicitor option isn't all that helpful. Yes, I agree, and that's why I think some people had they'd just found a friend who was happy to do it, which I appreciate is not open to everybody, because this is part of the problem as well, isn't it? It's a lot easier to build your network if you're naturally sort of outgoing, and you know, that sort of thing comes easier to you. It's a lot less easy if you're not in that situation. So yeah, Alexa or Google Chrome. Yes, lots of people had Alexa actually. That's a good point. Yes, advocacy and decision making. I'm glad to see that being discussed in AWOT groups. Yes, harder if you have dementia. Yeah, local. Thank you, Kirsty, for posting that link as well to local networks, supported by other research. And then Sue and Anne, you have free to be me in care training. Yeah. Yeah, how many more people with dementia are losing track of their LGBT identity? Yes, exactly. So what else we got? Margaret, feeling safe and comfortable. Yes, in sharing the diagnosis with other people. Yes, lots of stigma and understanding. I think this is really important. And we had a mix of people who were happy to share their diagnosis, because then that meant that people around them knew and they got support. And then other people who would just wanted to carry on as they were for the time being. And so, yeah, I think that's a real issue, and just shows how stigmatized it still can be in a lot of places. We had people who've been excluded from groups because of that. South Gloucestershire is doing good work, thank you, that's good. But yeah, how do you deal with that? I don't know. Sue and Anne is the answer there. I don't know what the answer is there. I think certainly, I've been Damian, do you want to come in there for the last minute? Just somebody unmute Damian. May not be able to do that himself.
Thank you very much. Yeah, well, yeah, I haven't got the magic wand either. Sue and Anne, yeah, I mean, and certainly we're aware of people living on their own. We really like to make contact, and you know, certainly in York with the Minds and Voices group that help facilitate, you know, we do try to sort of encourage people to sort of get that benefit of peer-to-peer support, but sometimes it's treading on eggshells. Sometimes it's a really long game in terms of building up trust. You know, if a chap has sort of withdrawn from support services, you know, there'll be a reason for that, and it's about building up relationships, and you know, and that can often take time, and sometimes it's just being there. But yeah, that's it. There's so much out of our hands. That you know, that's just the reality, isn't it? And yeah, a host of paperwork. You know, people living on their own, getting overwhelmed with. We saw that when we went to visit people who were living on their own. Often there was only one seat available in the house because the rest was full of paper that couldn't be put away, because then it would be forgotten. So it would be out, but then piling up. And that's a real issue. And you know, I've had chats from fire brigade saying, I'm visiting so and so, and this is a high risk. But then the person said, yeah, but I can't put that away, or I've got to keep that, I've got to act upon that. So yeah, really difficult in managing risk, and also, you know, the rights of people and the choices of people to make what others might consider you know, an unwise decision. And so yeah, really difficult. We're not pretending it's easy, but yeah, we just keep plugging away, I suppose.
Right, thank you all. We're getting booted out of this breakout room, 10 seconds. So thank you very much.